Hello, and welcome to this Global Engagement Online series, a program of the United Nations Association of the USA. My name is Shatishri Ravishankar, and I'm currently a Global Goal Ambassador for Sustainable Development Goal number 10, Reduced Inequalities.
My name is Sadie Luke, and I am also a Global Goals Ambassador for Sustainable Development Goal 10, Reduce Inequalities.
And we are absolutely delighted to be with you as part of this dialogue on a disability-inclusive response to COVID-19. In December, the UN recognizes the International Day of Persons with Disabilities. Realizing the rights of persons with disabilities is central to the promise of the 2030 Agenda for Sustainable Development. A global disability inclusion survey of over 500 participants on April 13th of 2020 reveals that people with disabilities are being impacted by COVID-19 at a higher rate than those without a disability. In fact, 51% of people with a disability have either lost their jobs, been laid off, or furloughed, or believe that they will lose their job in the next 90 days, compared to 28% of those without a disability. For all audience members, you can view more readings and resources regarding this topic at the link posted in the chat. You will soon hear from our guest speakers, after which there will be time for questions from you, the audience. Speakers will discuss how we can achieve transformative and lasting change on disability inclusion in this time of crisis and beyond, using the United Nations Disability Inclusion Strategy Framework and the Convention on the Rights of Persons with Disabilities.
If you have any questions at any time, please type it into the Q&A box, which can be found at the bottom of your screen on your navigation bar. Selected questions will be read aloud to our panel as time permits. Please note that the chat box will be used today to share your reactions to the worksheet we are providing. We hope that you will share how you plan to take action or are currently taking action to advance the rights of people with disabilities.
Thank you, Sadie. Now let me introduce our speakers today. I'll introduce them one by one and have them provide a brief overview of their work. Our first introduction is for Ms. María Soledad Cisternas Reyes, Special Envoy of the Secretary General on Disability and Accessibility. Professor Cisternas, I would like to turn it over to you to discuss your work.
Buenas tardes a todas, a todos. Un placer estar aquí. Y quiero contarles que mi rol principal es promover los derechos de las personas con discapacidad y la accesibilidad universal. Durante la pandemia COVID-19 hemos visto cómo ha habido dificultades enormes de las personas en el ejercicio de su derecho a la salud, por ejemplo, incluso la atención en cuidados intensivos, y también durante el confinamiento el acceso a bienes, a servicios, a medicamentos, a atención y cuidado personal, rehabilitación, bienes, servicios. Por esta razón, hemos podido ver cómo el hilo conductor de estas deficiencias es la falta o insuficiencia de la accesibilidad universal. Por esta razón, entre las tareas principales ha estado, además de contribuir con los documentos del secretario general, elaborar 5 statements o declaraciones específicas. Una que se hizo al principio, por allá por marzo-abril de este año, con el presidente del Comité sobre los Derechos de las Personas con Discapacidad, hablando de los principales problemas y dificultades que enfrentaban las personas con discapacidad en la pandemia. La segunda se refiere a la salud mental de las personas con discapacidad en la pandemia y se hizo con la enviada especial sobre COVID-19 de la OMS. La tercera se refirió al derecho a la vida y a la atención en salud de las personas con discapacidad y personas mayores, que se efectuó con la experta independiente para adultos mayores. La cuarta se refirió a mujeres y niñas con discapacidad y mujeres mayores durante la pandemia, que también la suscribí con la experta independiente sobre personas mayores. Y finalmente, aquella que se refiere a gobiernos locales, pandemia y personas con discapacidad y personas mayores, que se suscribió con la red World Enable y Cities for All. Además de estas declaraciones, que eran muy importantes en su momento para lograr dar directrices hacia los países, también se hicieron seminarios regionales a nivel global. Por ejemplo, en Asia-Pacífico, ahí en UNSCAP, UNESWA en Medio Oriente, con la colaboración de distintas entidades, en el caso de África, también con CEPAL en América Latina, y luego en distintos países que nos han pedido concurrir virtualmente de manera específica hacia sus realidades. Quiero decir también que ha habido contribución hacia muchos otros instrumentos que se han producido desde las Naciones Unidas, por ejemplo, lo que fueron los trabajos urgentes, los work stream, en relación a la pandemia, bajo ejes, por ejemplo, de trabajo, de financiamiento, de recuperación y restablecimiento en salud, de la situación socioeconómica, etc. Por lo tanto, ha habido un trabajo mancomunado, liderado por el secretario general, de estar pidiendo también rendición de cuentas de todo aquello que se va desarrollando en las distintas agencias o por los distintos mandatos en relación al COVID-19. Quiero señalar que evidentemente hay otras entidades que se han ocupado del tema, como la Oficina de la Alta Comisionada de Naciones Unidas para los Derechos Humanos, con instrumentos específicos direccionados hacia políticas públicas, y también la Organización Mundial de la Salud, que ha efectuado sus directrices en la materia. Por lo tanto, yo podría decir que ha habido un trabajo mancomunado donde también hemos unido la voz de los mandatos. Por ejemplo, ahora para el 3 de diciembre tenemos una declaración conjunta con el presidente del Comité sobre los Derechos de las Personas con Discapacidad, el relator especial sobre los derechos de las personas con discapacidad, y quien les habla como enviada especial del Secretario General de las Naciones Unidas sobre discapacidad y accesibilidad. Esta declaración va a salir mañana, el 3 de diciembre, donde hacemos presentes los aspectos más acuciantes de la pandemia, y ahora por sobre todo el restablecimiento en el ejercicio de los derechos humanos y libertades fundamentales. Muchas gracias.
Thank you, Professor Cisternas. I would now like to turn it over to Ms. Kristin Duquette, U.S. disability rights advocate, to talk more about her advocacy journey. Ms. Duquette?
Thank you so much for having me today. It's such a pleasure and honor to share my thoughts with you. I am a person with a physical disability. As a former world-class swimmer in the Paralympic League, political appointee in the Obama administration, and currently an analyst and a former director inside the Department of Homeland Security for the United States, I am a disabled woman under the age of 30 serving the American people. I am living proof of inclusion. And through UN efforts, we must integrate and include all persons with disabilities in all facets of our communities. So I began to be a swimmer and train internationally and compete internationally throughout my high school and college years. And into my college years, I studied the Convention on the Rights of Persons with Disabilities, specifically if disability rights are viewed as human rights through a UN context, with Article 30.5, which is the right to sport and physical recreation. And although that was a bit of roughly about 7 years ago, my thesis topic is still relevant today because there is so much work that continues that needs to be done for this demographic. I think it's important to note that the disability community is the biggest minority population in the world and continues to grow and expand. It crosses all minority groups. Yet, it is the most underrepresented in almost all facets of our communities. And we need to do a better job at that. So 3 things that I think would completely help with a lot of the efforts is, first, thank you for being on here today and wanting to learn more about such a crucial topic. Second, we need to make disabled youth a priority in all levels of our government and legislative agendas. This can be done by creative initiatives and program partnerships that prioritize this vulnerable group in marginalized areas throughout the United States. Another aspect that we can start to do is bring disabled youth to the policy and legislative decision-making process. Having that voice of diverse lived experiences in leadership roles promotes access and inclusion on legislative outcomes, and ultimately positively impacting citizens at all levels. The last thing that I think is the most important out of all of these is we need to stress to our politicians, specifically our United States senators, to ratify the Convention on the Rights of Persons with Disabilities in the United States. Yes, we have the Americans with Disabilities Act, and this country is very innovative compared to other countries in terms of disability inclusion. But there is so much positive impact that we can make on an international level too, in being partners, actual partners with other countries. If we not only have it signed, which we do, back in 2009, we signed it, but if we be on board and actually ratify it, there is so much impact that we could continue to do. And that's something that being part of UNA USA and talking with your politicians and working on the ground on that, I think is the most influential thing that we can all do to help push this convention forward in the United States. Thank you so much, and I look forward to answering any questions or concerns that you have throughout this conversation.
Thank you, Ms. Duquette. Our next panelist is Dr. Ola Abu Al-Gaib, Manager of the Technical Secretariat with the UNDP, also known as the United Nations Development Program. Dr. Abu Al-Gaib.
Thank you so much. Thanks for the invite to be part of the discussion today. As mentioned, I am the manager of the UN Partnership of Persons with Disabilities. And for those who do not know us, we are a partnership that brings together the main 9 UN agencies that support disability inclusion more globally, but also the main 2 global networks of civil society. One of them is the International Disability Alliance, but also the International Disability and Development Consortium. Along that, of course, we have our donors and supporters that are part of our governance as well. And as mentioned, we are hosted by UNDP as the Technical Secretariat that oversees the work of the fund. What I would like to share with you in the occasion of the 3rd of December, in this very difficult time, the learnings that has been emerging from our programs at country level on the situation of persons with disabilities when it comes to at least being protected and accessing basic services during this very difficult time that all the globe is facing. Our work is really mainly centered to provide funding. So we are a multi-partner trust fund. So we support joint programming through the UN system to countries, mainly to support the implementation of the Convention on Rights of Persons with Disabilities. Our programs usually require, as a must, a collaboration and partnership with both organizations of persons with disabilities and the government. And they are really mainly centered around policy and systems change and legal frameworks to comply with the CRPD principles, but also support the inclusion of disability in the implementation of the Sustainable Development Goals. What have we seen since the crisis started globally? What we actually, very early on in the year, we started receiving requests from our countries of operation that they wanted a lot of technical and financial support to help them make sure that the government response, which was in sort of the emergency mode at the beginning, to ensure that response is inclusive to persons with disabilities. We also received requests from our members globally, like WHO and others, that really wanted this collaboration and support across the agencies to ensure that the information is available to UN country teams and other actors for them to understand how to support the disability inclusion. So for that, we launched a global initiative that brought all the agencies together along civil society to provide or fill in the gap of capacity building and knowledge and ensure that countries are providing with the needed support on that matter. But what we have seen from countries as an evidence is that unfortunately, still countries are and have been failing disability in high levels of access to when it comes to persons with disabilities. And that started on the situation of the continuation of services for persons with disabilities with regards to the basic services. Then there was the element of protection from risk. Many of our countries where we operate, persons with disabilities faced higher risks to catching the virus because they had limited access to the PPE, but to the access to the information on the issue. And lastly, also, we could see that the voice of persons with disabilities and their organizations was still continuously missed when there was this multi-stakeholder approach to discuss issues around COVID situation. And these are key issues that we constantly supported and we will continue to support in the coming months to ensure that disability is not missed. Thank you so much.
Thank you, Dr. Abou-El-Ghaib. I would now like to invite Ms. Ruth Fernandez, Inclusion and Human Rights Advisor at UNDP Dominican Republic, to say a few words. Ms. Fernandez?
Okay, many thanks to the United Nations Association of the United States for this invitation. It is an honor for me to share this webinar with panelists and participants who are also committed to inclusion. On behalf of the United Nations Development Program in the Dominican Republic, we want to make a brief presentation of the response action that we have taken to COVID-19 based mainly on differentiated and cross-cutting approach that we are going to share now. Next, please. First, UNDP in Dominican Republic is committed to promoting policies and strategies to improve the inclusion of people with disability. The premise of leaving no one behind is an essential principle of our country program and our action. We are an inclusive team within which we have a volunteer from the UNB Talent Program for Young Professionals with Disability. Through our programmatic work, our office works for the recognition, protection, and guarantee of the rights of vulnerable groups in the country. For more than 4 years, we have worked in conjunction with the public institution, the private sector, and organization of people with disability, applying differentiated and transversal approaches to disability. Next. An important turning point has been to have an interagency project on disability, inclusion of people with disability in the Dominican Republic, public project supported by UNPRPD, and in which UNDP, WHO, and UNICEF work together. Through this project, and being aware of the importance of providing an emergency response to COVID-19, we have carried out the following action: preparation on disability technical note with recommendation and guidelines for mainstreaming and integrating people with disability in the response and recovery from the emergency due to the COVID-19 pandemic. This note was made for all the personnel of the system because it's the first moment of the pandemic. All agencies were working to design public policy, and we want our colleagues to have information that these public policies were inclusive. The Organization of People with Disability asked us for support for donation of masks, and that is how we are able to distribute 10,000 masks nationwide. And finally, we prepared and disseminate 3 accessible videos to raise awareness about the coronavirus and the ways to prevent it. Next, regarding the actions that UNDP has developed independently and with a differentiated approach, it has been survey COVID-19 situation and people with disability in the Dominican Republic, an online platform for data visualization. Survey conducted at the national level for people with disability. The survey was conducted together with the National Disability Council, which is the governing body for disability policies. This survey has been a fundamental element of public policy advocacy. Next. Regarding the recovery measure we have implemented, at this time, we are implementing an inclusive socioeconomic recovery program. This program consists of a set of actions to strengthen the capacity on business skill of people with disability, migrant, and LGBTI people who want to start business or have a small and micro enterprises. With the support of the Ministry of Industry and Commerce, training and workshop are being carried out aimed at people with disability, migrant, and LGBTI people, as well as panel on good practice in inclusive recruitment, mentoring, and the celebration of the Inclusive Entrepreneurship Week. We must change the development model and redouble our effort towards a post-COVID-19 recovery guide by the principle of inclusive development, equality, and sustainability. And to finish, we present our action related to transversal approach. Among we highlight analytical study action promoting the mainstreaming of disability approach in socioeconomic response, for example, a strategic plan of response of COVID-19 in Dominican Republic, support for the mainstreaming on disability in response project of public and private institutions, for example, the National Tourism Program, the reform for judicial digitalization, or the distant education program. And support for the preparation of a survey applied to a sample of household to measure effect of COVID-19 for the response strategy, ensuring that it includes questions related to the issue of disability as well as interviewers with disability. At the UNDP in Dominican Republic, we are clear that we must not only carry out differentiated actions for people with disability, but also this must be accompanied by a transversal approach that highlights the importance of our inclusive action and therefore the United Nations Disability Inclusion Strategy. Muchas gracias.
Thank you, Ms. Fernandez. It is so inspiring to hear from leaders who are dedicated towards protecting human rights in these critical times. And we are so glad to have you all with us today. Before we head into the Q&A segment, we would like for you, the audience, to participate in a brief poll that understands your thoughts on disability inclusion. So I would now like to turn it over to Ms. Anna Mahalik, a member of our UNA staff, to lead us in this activity. Anna?
Hi, everyone. Please go via your phone or your laptop to menti.com and enter this code here. We have a couple quick questions for you, as well as some questions that you can answer in the worksheet that you can find in the chat. This is a great way for us to get to know you better, who's in attendance today, and to hear directly from you of what's happening on the ground. So I'm going to pull up our Mentimeter poll so that we can see all of your responses. And again, with the code, please go to menti.com and use the code 900532. You can go to menti.com and use the code 900532. And you can answer this question that we have here. How would you rate your community on disability rights and inclusion? And we have 3 options for you to choose from. Not at all inclusive for people with disabilities, inclusive for some people, but not all, or very inclusive for people with disabilities. Please go ahead. This is our first of 2 questions that we'll be asking the audience during this interactive portion. And then of course, we'll be hearing your questions at the end. You can continue to use the chat box to elaborate on your answer and share why you chose the option that you did. And we'll just give it a couple more seconds for everyone to go to menti.com, enter the code 900532, and then we'll be able to see your responses to this question and our second question. And then Sadie, we're starting to see some responses come in. Mostly what we're seeing is that people are saying that their communities are inclusive for some people, but not all. All right, we'll move on to the second question. It's the same code of 900532. And this is a word cloud. You'll enter one word in your laptop or on your phone about what is an area where you think we need to see more progress for disability inclusion. This could mean a lot of different things. I think a lot of words could arise in terms of issue areas, specific types of inclusion, specific metrics that we need, ideas in your community. Feel free to put whatever first comes to mind, just one word about an area you think we need to see more progress for disability inclusion. I'm starting to see some answers come up. Hidden disabilities, university leadership, infrastructure, workforce, among the homeless population, schools, in the medical profession or in medical settings, transportation, mental health, unhoused persons connecting back to homeless persons, non-physical disabilities, prosperity, economic equality, policy and decision making. These are all really important words. Feel free to react in the chat box to maybe the word that you put or a word that you find to be interesting that someone else put. Certainly the words that seem to pop up most from our audience today are education and schools. Thank you all so much for participating in this portion of the interaction. Please continue to use the chat and your worksheet to follow along with us.
I just want to also invite everyone to use the chat box to share how you plan to take action or are currently taking action to advance the rights of people with disabilities. You can also complete our action worksheet as you participate in the webinar to record your top takeaways from this discussion.
Thank you to everyone for participating in the polling. At this point, I would like to head straight into the Q&A section. Our first question is for all panelists. What are some ways the UN is advancing disability rights, whether through a resolution, committee, or other initiative? And what are some challenges we face as a global community in securing disability rights as human rights?
No sé, ¿puedes hablar? ¿Te puedo responder? ¿Sí?
Sí,
Ok. Ya, muchas gracias. Bueno, Naciones Unidas desde ya hace un par de años creó la estrategia de inclusión de las personas con discapacidad en las Naciones Unidas, lo que tiene que ver con los pilares de paz y seguridad, derechos humanos y desarrollo. Esto tiene por objeto ver diversos aspectos de manera transversal en Naciones Unidas e interseccional. Por ejemplo, la inclusión laboral de personas con discapacidad en el sistema de Naciones Unidas, la accesibilidad universal en Naciones Unidas, tanto en la sede principal como en el terreno. Esto ha implicado entonces que se ha puesto en ejecución este plan. Hay al principio 157 entidades de Naciones Unidas que han rendido cuenta. Ha habido un progreso en esto y así lo declaró el secretario general en octubre de este año. El progreso que ha habido, también aquellas buenas prácticas ocurridas, los retos, aquellos puntos más difíciles y cómo se pueden coordinar las distintas instancias para diseñar de ahora y hacia el futuro de tal manera que Naciones Unidas pueda dar un ejemplo de esta inclusión de las personas con discapacidad en el mismo sistema. Ahora, si a mí me preguntan en lo personal cuáles son las claves, para mí, la primera es la toma de conciencia. Yo creo que están los derechos y eso está bien, la convención lo dice claramente, pero mientras la sociedad no tome conciencia que las personas con discapacidad son y somos titulares de derecho en igualdad de condiciones con los demás, no podremos dar pasos más adelante con el marco jurídico y con lo que es la Agenda 2030, por supuesto. Y en segundo lugar, como lo decía al principio, el eje conductor que significa la accesibilidad universal. O sea, hay toda una relación entre la deficiencia del ejercicio de los derechos y la falta o insuficiencia de accesibilidad, no solamente al espacio físico, como decía, información, comunicaciones, transporte, servicios, y que implica también la capacitación del personal, tanto en zonas urbanas como rurales. Eso es lo que yo pudiera decir como una síntesis.
I think to answer your question and the first question about what the United States is or what the UN is doing great is I think that it's been incredibly innovative in creating policies and international conventions that are working towards the rights of all people based off of their humanness. I think where we need to do more work is to hold our countries accountable. And I will not stress this enough that we can hold the United States accountable. We can do this from a bottom up effort and a top down effort. But the United States is a democracy. It serves its people, and the people that it serves also includes people with disabilities. So we need to recognize that group, and again, in all facets, including enduring COVID and in pandemics. We have to do that. So we need to start with our local politicians and then our public servants in all levels of our government. That's something that we have to do that I think the UN can try, but we need to do that as the people inside the United States too.
Can I come in as well? So to answer this question, of course, we know that the UN system contributed to two main global frameworks the last decade and even earlier. The UN Convention of the Rights of Persons with Disabilities was a global landmark when it comes to supporting and understanding the preconditions to disability inclusion. But also 5 years ago, the adoption of the new Sustainable Development Goals made also a new global commitment to ensure that disability is anchored within the development thinking. Now, the UN system at country level also has a leverage that we constantly need to remember and use as much as possible. The collective effort from the UN system to collaborate and push the government to be more inclusive is an advantage that we need to, as I said, keep reminded of and ensure that collective effort at country level between the UN system, the civil society, and government. Because without that, we can't achieve that unified understanding on what needs to be in place to ensure that persons with disabilities have that equal access to services. Now, what do we need to do more? Honestly, from my experience of supporting financial and technical initiatives at country level, the global commitment to disability inclusion is still very minimal. We have now 188 countries that committed after the adoption of the convention to support disability inclusion, yet they still need to know how, but also need the financial resources to do it. We have been struggling to allocate resources, even to our fund, to support those countries. So that's not acceptable. And global development actors need to put their actions into the words they have committed to. Otherwise, we're gonna still see disability as a small ad hoc initiatives at country level without sustainable changes for the lives of people in those countries. Thank you.
Creo que mis compañeras han comentado todo, no creo que tenga nada más que decir. Creo que hay 3 elementos fundamentales, que es la Convención de Derechos de Personas con Discapacidad, la Agenda 2030 y los Objetivos de Desarrollo Sostenible y la estrategia de inclusión de la discapacidad, que hay que ponerla en valor como sistema de Naciones Unidas y como colegas del sistema, ¿no? Creo que esto es fundamental.
Thank you for all of your insightful responses. Our second question is, what lessons have we learned during the pandemic regarding the challenges and opportunities for people with disabilities? How can we achieve transformative and lasting change on disability inclusion during this time of crisis and beyond?
Bueno, desde mi punto de vista, creo que el gran elemento a destacar es la participación de la sociedad civil. Sabemos que la Convención sobre los Derechos de las Personas con Discapacidad de las Naciones Unidas nos habla de las consultas estrechas que se deben realizar a las personas con discapacidad a través de sus organizaciones representativas en todos los asuntos que les atañen y más aún en todos los asuntos públicos, ¿no? Finalmente, el nada sobre nosotros sin nosotros sigue siendo un lema vigente hasta la actualidad. O sea, y hoy día más amplio aún, nada sin las personas con discapacidad. Entonces yo creo que cuando las Naciones Unidas nos hablan de que el COVID-19 debe tener una respuesta participativa e inclusiva de las personas con discapacidad, en este momento está dando una directriz muy importante que se aplica ahora en la pandemia, pero es una directriz para todo asunto público en que haya que definir políticas públicas, legislación, planes, programas, proyectos, etc. Esta participación plena y efectiva en la sociedad, que es lo que busca la Convención sobre los Derechos de las Personas con Discapacidad, es precisamente el horizonte que debe tener cualquier estrategia, cualquier política o legislación hacia el futuro. Y en ese sentido, quiero ser bien tajante y categórica en decir que las organizaciones de personas con discapacidad a nivel nacional, local, regional y mundial han estado a la altura de las circunstancias. Hemos visto cómo muchas personas con discapacidad se han incorporado en grupos de trabajo a través de los cuales han salido instructivos, reglamentos para la atención en salud de las personas con discapacidad. ¿Qué pasa en el confinamiento? ¿Qué pasa en el ejercicio del derecho a la educación remota cuando no es inclusiva de los estudiantes con discapacidad? ¿Qué ocurre con el trabajo a distancia? ¿Cuánto se ha mermado la inclusión laboral de las personas con discapacidad, etcétera? Yo creo que ese es un elemento muy significativo, la voz de las personas con discapacidad sobre la mesa, y el otro elemento es cómo hoy día los gobiernos locales, por supuesto, que están entre el gobierno central y el ciudadano, han sido un engranaje muy importante para traducir la respuesta inclusiva y participativa de los ciudadanos hacia los gobiernos centrales, y los gobiernos centrales a su vez brindar los apoyos y la diversificación para cumplir las necesidades de las personas con discapacidad. Gracias.
If I could just make this short and quick, I think one of the things that we can continue forward after COVID is technology, our use of technology. A lot of things that, especially here in the United States, that persons with disabilities have worked so hard to receive in terms of work accommodations for working at home. We've had now a pandemic push a huge portion of our population, disabled and able-bodied, towards working from home and accessing technology. I hope that technology in the sense of grocery deliveries, more working from home access to telehealth, these are things that the disabled community needs. And it's not a nice thing to have, right? And I think a lot of people are seeing that now because a pandemic has pushed the entire population to do that. So going forward, I would like to see more use of technology that we're doing right now for a pandemic in a normal and healthy non-pandemic situation.
Okay, so for me, it's really, so what is our ideal scenario? What did we learn from the pandemic? Unfortunately, we learned that again and again, persons with disabilities are left behind. Despite the global promise that people with disabilities and many other most marginalized groups will not be missed, we're seeing that disability has been missed. People are at higher risk. There are higher mortality rates when it comes to persons with disabilities. They're facing further complications in their life. They are deprived from accessing any available services now in most of the countries. So the reality is not very promising. Now, what needs to be changed? We need to learn, we need to act. We can't constantly rediscuss the same things each time we come out from crisis. We need just to realize that these things are essential and needs to be now considered in the recovery phase. Otherwise, next couple of years, we will be back to discussing this again, and that's not acceptable.
Ms. Fernandez?
Sí, bueno, creo que lo que pudiéramos destacar como desafíos es como comentaba María Soledad, ¿no? Todo el tema de la accesibilidad universal. Accesibilidad universal a los servicios públicos, justicia, educación que luego conlleva trabajo. Esto entendemos que es fundamental, que sea un hilo conductor para todo nuestro accionar.
Thank you so much. Now for our final question, before we head into the audience Q&A, in one sentence or less, what words of advice do you have for UNA USA members who are hoping to take action and stand up for disability rights in their communities?
Bueno, mi consejo fundamental es que en esto hay que adoptar un liderazgo que deben tener las personas con discapacidad para interactuar con sus autoridades en los planos locales, nacionales, regionales y globales, en relación al ejercicio de sus derechos humanos y libertades fundamentales, de tal manera que no se vean afectados ahora en esta situación de emergencia humanitaria, pero tampoco en el futuro. Ahora, ¿por qué pasa este liderazgo? Pasa por estar conectado, hoy día sí podemos hacerlo por la tecnología, en muchos casos, de estar conectados a lo que va pasando en distintas partes del mundo, al direccionamiento que desde las mismas Naciones Unidas se nos van dando. Por ejemplo, estamos en la década de acción 2020-2030, o sea, 10 años para cumplir la agenda sobre desarrollo sostenible. Y la frase allí es dar ideas para obtener soluciones. Bueno, ahí cada comunidad local sabe perfectamente lo que necesita y lo que debe ser la exigibilidad ante las autoridades respectivas. Tenemos el documento de políticas que hizo el secretario general a quien me he referido, colocar a las personas con discapacidad en el centro del debate para la elaboración de políticas públicas inclusivas en el futuro. Y también está la reciente resolución de la Asamblea General en noviembre pasado que habla de desarrollo para y con las personas con discapacidad. Yo creo que estos son verdaderos escudos, ¿no es cierto? Verdaderos emblemas que tenemos para hacer exigible eso ante nuestras autoridades con un liderazgo de personas con discapacidad que sean conocedoras de todo lo que está aconteciendo en este ámbito en el mundo. La unión hace la fuerza. Gracias.
In one sentence, I'll try and keep it to one sentence, is I would say to work from the ground, get to know your communities, get to know all the different people in your personal, professional, all facets of your life that are disabled as you see them as persons, which disability is part of their identity and it's huge. Get involved in other local communities that are working on disability advocacy, whether that's through sport. Sport can be largely underrepresented in the United States for persons with disabilities, to 100% getting politically involved in knowing the different policies and legislation going on in your states and on the ground. Every single thing that we do in policy and legislation impacts the disability community. So we have, it's all intersectional. So those are the few things that I would advise to start from.
Dr. Abu-Elgay?
Yeah, I mean, for me, you need to start to understand what are your rights, what are the obligations of the government towards you, because that's the starting point. In many cases, persons with disabilities, no matter where they are in the world, they don't know what is existing on paper, and they need to know that because that's their entry point. And then once you do, of course, the more you collect efforts with people on the ground, with organizations nationally, the better it is because the voice will be stronger. And then the political pressure on the government will be much stronger. But as I said, you need to understand your realities, but also your rights. What is the government entitlements towards you? And then from that, this is where you can really make a difference.
Sí, bueno, en una frase, ¿verdad? Para los colegas que nos están escuchando, los colegas de la Asociación de Naciones Unidas, yo como colega también de Naciones Unidas, del PNUD en República Dominicana, yo la recomendación más grande que le hago, independientemente de la posición que usted tenga, ya sea programática o de operaciones, cualquier posición en la que usted tenga, tiene que conocer la estrategia de inclusión de la discapacidad de Naciones Unidas y tiene que ponerla en práctica, sin lugar a dudas, porque esto va a marcar la diferencia. Gracias.
Thank you. I'm certain that our audience members will carry these words of advice to take concrete actions and mobilize change within their communities. So I would now like to turn it over to Sadie Luke, fellow Global Goals Ambassador, to moderate the audience Q&A. Sadie?
Thank you so much, Cherie. So unfortunately, we only have time for just a few questions, and from the audience, although there are many, I think the best one to start with, which is directed at any of the panel, is what do you consider to be the best example of CRPD working as it should? And instead of having every member of the panel answer this is directed at whoever would like to answer. I think it would be, oh, sorry.
Yeah, I mean, for answering the question of what needs to happen for the convention to be implemented, well, seriously, we have to push for action, because the most important thing is not just to change policies and laws. Of course, it's nice to see things on paper, but the realities of people will not change unless we see it translated into programs, services that are accessible, inclusive, and available to everybody, and affordable to everyone. Because I know from the experience of the US, living here now, it's not everything is affordable for people. It's the best quality of service and care globally, but not everyone can access it. And that's one of the key elements of seeing the reality on the convention implemented, is the person changing his life in a way where he wants without any limitations. That's when we say, oh, okay, now the implementation is implemented.
Oh, Sadie, I think you're muted.
Thank you so much, Cherie. Thank you for your answer. I think we have time for just one more question, and I think this question would be best directed to Miss Kristin Duquette. What can a high school aged person do to get involved and advocate for people with disabilities during the pandemic?
Absolutely, thank you. So what I would first ask is if they identify as a person with a disability or not. I think that is going to be a huge question to first go off of. We need allies, right? Integration, inclusion, all of that is not and should not be depicted just on one demographic. And if you want a whole community approach, I mean, if you want the whole community to change, you need a whole community approach. So from a high school perspective, I would look into if there's any particular organizations on the ground in your area that also align with your interests. What are you actually really passionate about? Because I guarantee you, disabled people are also involved in whatever you're also passionate about. So start from there. And then I would also say, look into who's your local mayor, who is your local state senator, and what is on their agenda. Who are those people? And do they have disability in their policies? Are they thinking about it? Did they think about it in their campaigns? You don't see that when we talk about political outcomes and campaign data. Disability is not on there in the United States. We see a lot of other demographics, but not that. And disability is a huge demographic that also votes. So start there, I think, and I'm more than happy to chat about that offline too.
Thank you so much. I absolutely agree that advocacy is a great solution for people to advocate for people with disabilities. Unfortunately, we do not have any more time for questions, although there are many great questions. As we have discussed during the panel, COVID-19 is having a disproportionate impact on people with disabilities, and disability rights are human rights. The United Nations and its agencies have long taken a leading role in standing up for human rights. The United States must restore its global leadership to ensure that the human rights are protected for all. Please text HCR to 30644 to support the UN's efforts to advocate human rights and restore U.S. leadership in the UN Human Rights Council. There are many, many more ways you can take action as a member of UNA USA. When you join UNA USA, you are joining 20,000 other Americans around the country like me who understand the importance of the UN. I joined UNA because I understand that we need the UN to support human rights and the Sustainable Development Goals 10, reduce inequalities. Join me by becoming a UN advocate at unausa.org.
And finally, please join us for more upcoming UNA USA events. Tonight at 8 p.m., there will be a session on addressing gender-based violence at the local level. And then for Human Rights Day on December 10th, join us for Agios on an artistic approach to advancing human rights. To our panelists, thank you so much for taking the time out of your busy schedules to have a dialogue on the need for disability inclusion. It is so important for us to be aware of how we can be more involved in protecting human rights for all. And I'm certain that your remarks will inspire participants to take action in their own communities. Once again, thank you to our incredible panel. And finally, a big thank you to everyone for joining us today.
Thanks, everyone. Bye-bye.